my presentation for PC 711. The title of my project is Education of Nurses to Support Natural Childbirth and Laboring Women. And I'm Hope Mitchell. Childbirth practices have changed dramatically over the past 25 years, from birthing at home to a highly technological hospital setting. According to the World Health Organization, the goal of maternity care is to achieve a healthy mother and child with the least amount of interventions as possible, with safety as the priority. The definition of natural or normal childbirth, according to the Joint Policy Statement on Normal Childbirth, 2008, includes a spontaneous onset of labor progressing to spontaneous delivery between 37 and 42 weeks gestation, with little or no human intervention. Melander of 2006 found increasing numbers of women are expressing the desire to give birth naturally. According to Romano and Lothian, social and cultural changes have made women insecure in their ability to give birth naturally. Through continuous labor support and a nurse educated in supporting natural childbirth, their desires can become reality. With increases in technological approaches in place to manage labor and birth, registered nurses are challenged with competing priorities for their time and attention. Nurses' own personal perceptions toward natural childbirth practices may also play a role in their influence on laboring women. The education of labor and delivery nurses in supporting laboring women wishing to birth naturally is an important component in providing quality care in this patient population. A woman's perception of their birth experience can greatly affect subsequent births and have a lasting impact on her self-confidence and self-worth when the birth outcome is not how the laboring woman planned. According to the Association of Women's Health, Obstetric, and Neonatal Nurses, continuous support during labor by an RN is a crucial component in achieving improved birth outcomes. Providing a supportive environment focusing on a woman's individual expectations and needs is a key role of the nurse. New nursing orientation to labor and delivery is highly focused on the technological aspects of birth and provider preference, not on how to support a woman during a natural labor and birth. Description of the learner. The learner would be a registered nurse in the Family Birthing Center at St. Luke's Hospital in Maumee, Ohio. The RN would be working a minimum of 6 months as a labor and delivery nurse. The 6-month time frame was chosen to allow time for the newer RN to grasp basic unit policies and procedures, as well as the flow of the unit. The RN is proficient in managing highly technical methods associated with childbirth as needed should an emergency arise. The learning goal. The goal of this self-learning learning module is to educate providers and staff at St. Luke's Family Birthing Center on the importance of supporting laboring women wishing to have a natural childbirth based on evidence-based guidelines and achieve 80% or higher on the post-test at the end of the learning module. The objectives. Objective 1. At the conclusion of the web-based learning module, the learner will be able to correctly identify low-risk laboring women wanting a natural childbirth 100% of the time from the 3 cases provided. Objective 2. At the conclusion of the web-based learning module, the learner will be able to summarize the definition of evidence-based practice and associated guidelines for low-risk laboring women wanting a natural childbirth. Objective 3. At the conclusion of the web-based learning module, the learner will be able to identify at least 3 non-invasive interventions to support a low-risk laboring woman in natural childbirth. Method and instruction. Self-learning module. The self-learning module is self-contained and interactive instructional tool that guide the learner through step-by-step process in achieving educational objectives. The material is made a web-based learning module. The material is made accessible on the internet and typically has text, graphics, animation, audio, and video. This method presents the most up-to-date content that is self-directed and self-paced. Information presented on a specific concept, allowing the user to skip sections already mastered, and contains self-checks throughout the module consisting of pre-tests and post-tests. Literature review. The use of self-learning modules to facilitate learning of basic science concepts in an integrated medical curriculum indicated strong student acceptance of self-learning modules to prepare for in-class discussion and aid in learning basic science concepts. Reporting learner control, self-learning modules, and the use of key factors for improving their knowledge. And this was a study by Khalil, Nelson, and Kibble in 2010. Another literature review was the use of self-learning modules to facilitate learning of basic science concepts in an integrated medical curriculum indicated strong student acceptance of self-learning modules to prepare for in-class discussion and aid in learning basic concepts. Reported learner control. This literature review, this study looked at using self-learning digital models in dermatology, noting lack of trained faculty and low priority placed on importance of teaching dermatology in undergraduate medical curricula as obstacles. There was a positive response from the students using the program, stating they found it simple, intuitive, interactive, and enjoyable. Also noting using the module helped the students gain confidence and stated they would use it for future reference.